Inspecting first. So I'm looking at his precordium. Where's the precordium? Right up in the middle. So again, you'd be looking at the precordium. You're looking to see if you, once again, you're looking at the skin, you're looking for any scarring, maybe they had heart surgery. So you're looking for any, if you see that, you're like, well, hey, do you have a bypass or what, we're finding out if they had any scarring, midline, anything along the chest. You're looking for that. Any abnormal lesions. Again, it's the same thing. You're looking at the skin and every system. Abnormal vein pattern, pulsations up high, anything like that you're looking at. So you're looking at, is the chest even? Is his chest, you were looking at his thorax anyway, but again, that precordium and that sternal area. So again, you're inspecting for look at that sternum. That's what you're looking for. So look at that precordium. Now, you're looking to see if you have any heaves, and what you should be saying is, I don't see any abnormal skin lesions, the skin is normal color, I don't see any scarring, I don't see anything unusual. I don't see any heaves, I don't see anything like that. A heave, right? Something that's bulk, or thrills, or not thrills, but any bruising, you're not seeing any changes in the skin. But then again, you want to get to the side. That's a for sure on these things. There are a two-part that you're looking at. You're looking at it straight on, and they want to see that you're looking at it from the side, that you don't see any heaves or lifts or any unusual pulsations anywhere. So that's all that they're talking about. That's it for looking at it. You can look at the PMI, mid-clavicular, fifth intercostal space. You're looking over this precordial area. Do you see anything? So we don't see anything, so everything seems to be fine. I don't see any lifts, heaves, nothing like that. So that's inspection. Okay? So now palpating is mapping things out. And so remember what we talked about. Go back to your anatomy, and this is where you do want to practice. You don't have to be perfect, but you want to practice with your partner. I'm going to throw it right your clavicle here, right? So when you're mapping it out, where's aortic, right? Second. Okay. So here's this clavicle, and underneath there should be rib 1 in there somewhere, right along his clavicle. So what I would say to practice with someone is, I used to roll my fingers over there. There's one. There you are. So you roll your finger over the clavicle, and you can feel it. So just practice. So again, here's clavicle. 1 is right underneath there in the space, and then you should find 2. And then so then your mid-clavicular, right? Okay, you can also feel the manubrium and then the angle of Louis. This one is always hard sometimes to feel. But it's you're in line right here with this section. So anyway, now mid-clavicular, second intercostal space. So where should I be? Aortic. So aortic. So this is your palpation part, is mapping out the spots. So I should be able to go straight across. You doing all right so far? I'm not making you laugh. I'm just saying. So there's mid-clavicular, clavicle, mid-clavicular, pulmonic. So what's herbs? Best place for rate and rhythm, right? So aortic and pulmonic, you're going to have to say best place to hear S1, best place to hear S2. So you're mapping out S1, S2. Then you get to the third. Again, roll your fingers, practice. I can feel the herbs. I roll right over them. There's my next space. That's herbs, right? So then you move on. 4, 5. So again, we're going to be mid-clavicular. We run into mitral and then tricuspid, right? Tricuspid, and then over